Good morning. I'm here to talk about the defeating of the Blunt Amendment. This is an amendment to the highway bill in which we could, if we pass the highway bill, we could create thousands of jobs in construction and get America rolling. Instead, we have to deal with the Blunt Amendment, which is an attempt to once again derail the ability for the American people to get the health care services that's deemed essential by their doctor. The Blunt Amendment is a significant overreach in terms of a new power to employers to deny health care. Now, make no mistake, this is politics masquerading as morality. Politics masquerading as morality. What does the Blunt Amendment do? It allows any health insurance company or any employer to deny coverage for any service they choose based on religious beliefs or moral convictions. What's a moral conviction? Where does a moral conviction come from? I have moral convictions. You have moral convictions. We have different moral convictions. And let me repeat, any employer can do this. Any insurer can do it based on a vague abstraction called moral conviction. What would this mean? Yes, does it mean that women could, if you have a moral conviction that you want to have children that you know you can care for and afford, you have a moral conviction that you want to have access to birth control. If you have a belief that you need to have the health care that you need, based on what learned societies say are an essential benefit, you should. But under the Blunt Amendment, if an employer has a conviction against smoking, they can refuse treatments for lung cancer or emphysema. If an employer says, I don't approve of drinking and I refuse to cover any treatment program for alcoholism or substance abuse, they could do it. There could be an employer who has a moral conviction against blood transfusions and refuse to cover that. It puts the personal opinions of employers over the practice of medicine. The personal opinions of employers over the practice of medicine. We must remember that the preventive health services insurers are required to provide were part of health care reform. The essential benefit package is being developed by the states. The preventive health care package was not developed by politicians. It was developed by the Institute of Medicine, a learned society that said what would be the key benefits necessary to do this. I urge the defeat of the Blunt Amendment because we cannot provide this wide latitude to disrupt, derail the ability of people to get health care.